Hello, we are going to start looking at the changes being made to the acute care note templates. First and foremost, we are getting rid of the limited oral evaluation form. It is no longer going to be in there. You do not have to fill it out, but that information will all need to go in your note. So we're going to make some changes to the note templates. As always, when you log in, General Dentistry is the department for acute care. And then currently, when you go to the acute care tab, there are many different note templates. We will be getting rid of some of these with our changes and getting rid of the limited oral evaluation form. After hours call will remain in there for seniors that are covering the emergency phone. Juniors, you are able to use that form if you'd like to document something that the patient calls you and you want to have into Axiom. Diagnostic caries removal, extraction, and pulp therapy will remain as templates, but they will change to the basic template that we will be having instead of the limited oral evaluation form. This is your entire note. That is the acute care note. We'll also keep the nitrous form. So we'll be getting rid of things like occlusal adjustments, re-cement crown, denture repair, and the old blank template. Let's go into the current new blank template. This pretty much follows the order of what you would do for the limited oral evaluation form. You go through medical history. You can put things in here like 13 weeks pregnant. Whatever is maybe something you'd want to know for that specific appointment. 13 weeks versus 20 weeks versus 30 weeks. It's nice to document exactly what's going on and what might be something that you take into account if you're looking back at a note. Pre-medications, none indicated, or 2 grams of amoxicillin, whatever you may want to put there. Chief complaint. This is the patient's chief complaint in their own words. You don't necessarily have to put quotes, but it doesn't hurt. So you could say, toothache for 3 weeks, but getting much worse, 10 out of 10 pain the last 2 days. So this is where you start your limited oral evaluation. This is your exam. This is what you're looking for and what you're finding. So most of the time you're going to have pulp tests here. You've already said you're doing a limited oral evaluation. Should you not do a limited oral evaluation, you could put no fee visit or something like that in there. But most of the time you're going to have a limited oral evaluation, so to keep it from being missed as far as a code, we put it in there in the template. So pulp tests, what did you find? Number 14 tests to cold and percussion. And here's a big one, recreates patient's chief complaint. Now, you'd also probably want to know, what about the other teeth? Did you test everything else? So, all other teeth in upper left quadrant, test with the number limits to cold, percussion, and bite maybe. This is where you're going to find all of the other information visually that you see in that area that you're testing. So, broken distal buccal cusp, number 14, with obvious recurrent caries associated with existing MOD amalgam. Something like that. Now, you've taken all of that information and you're saying, I'm pretty sure it's 14, I'm pretty sure that it is reacting differently to cold and percussion. So, what do I need to confirm my diagnosis and treatment options? You probably know your diagnosis already of irreversible pulpitis with symptomatic apical periodontitis. However, you don't know if it's restorable. You don't know how deep that goes as far as the caries. You don't know where the bone is. Do we need crown lengthening, things like that. So you'd then go take your radiographs. Say we took 1 PA and 1 bite wing. Now, consults. Who did you consult with? Let's say fix an endo. Now, this is when you can probably say that you have a diagnosis. You may have a differential diagnosis. You may not know what it is for sure, but this is where you would put either differential or your final diagnosis. So let's say symptomatic irreversible pulpitis with symptomatic apical periodontitis. Number 14. Now, keep in mind, you have to put the number of the tooth. A lot of people miss that they put the exact diagnosis, but you don't know exactly which tooth we're talking about. So if you don't have a tooth number in there, it's not a diagnosis, unless it's not a tooth-related diagnosis, like pathology or something gingivally. Recommended treatment. This is what we recommend overall. So we're going to say root canal, build up, crown, number 14. Priority treatment, today's treatment, that's what we're going to do today. That is the first thing we are going to do when we are done talking to the patient about their options. Say that the patient says, well, I don't want to start a root canal today, or I want to think about it. They could have no treatment that day. They could say, you know what, let's do the pulpal debridement, start the root canal, and go on from there. So let's say that for this we're going to say pulpal debridement today. That could also be something completely different, like extraction. Patient could say, nope, I don't want to do that. I want to extract the tooth. So after that, I would say patient elects for extraction regardless of any potential restorative or endodontic prognosis. So saying you talked about these things and said that we have a pretty good prognosis or a fair prognosis or whatever it may be, and that we recommend the root canal, but patient says, nope, I want it extracted. Next line, you would say patient reviewed and signed a consent form. If you're doing a limited oral eval, for most things, you're going to have a consent form, whether it be a pulpal debridement or extraction. If you're doing a bite adjustment, you don't necessarily have to do that. If you say no, you can just delete it. This is kind of a speed bump to say, hey, yes, I actually had them sign the consent form. Next, anesthetic. Please remember, we use 18% topical benzocaine, and then 36 milligrams of 2% lidocaine with epinephrine, 1 to 100,000 ratio, however much you use. Treatment. You're going to have to put in all of the treatment that you do. This does not include the exam, so you don't have to put in limited oral evaluation anymore. You don't have to put in pulp tests anymore. Just the treatment that you did on the teeth. So, say if we were extracting the tooth, surgical extract, number 14. Sectioned tooth in 3 pieces and removed each root individually without incident. You can put other information in here. The blank template, you have to write a lot more. There will be other templates, like I said before, about extractions, pulpal debridement, and diagnostic caries removal that will have a little bit of this in there for you. Complications, as always, if you have any complications, or if you don't have any, put none. Prescription, you don't necessarily have to have a prescription, but you can put recommend OTC pain meds to say, hey, yeah, we did talk about a prescription or a lack thereof. And then, I know this is going to make a lot of people happy, we have gotten rid of disposition. Disposition is no longer a word used within Axiom. Next visit. So, are they coming back? We extracted the tooth. Next visit would be assessment clinic, if patient desires. Hit add new, and this is the only documentation you need to put in other than your pulp test form. Other than the blank template that we are adding to Acute Care, we will have 3 ready-made templates for extractions, diagnostic caries removal, and pulp therapy. Let's take a quick look at each of them. With extraction, it has most of the same things, but talks a little bit about post-op instructions. Not a whole lot different, but just has a little bit more. if we go in and say, did a diagnostic caries removal. The information in here, not a whole lot different, but we add, is the tooth restorable? Now, this may be, we don't know. So, perhaps pending caries removal. And then hopefully you would say again, this is what we determined the restorability to be once the caries was removed. With pulpal debridement, there is a little bit more information. We talk about using a rubber dam, open tooth number, debridement of number of canals, similar to the note that we had previously. This is what we are changing. If you guys have any questions, feel free to ask. We will probably change things a little bit as we get into using them and figuring out what has worked or what is not working. As always, if you have any questions, let me know.